Ginger gets sold as nausea relief, inflammation control, blood pressure support, and sometimes almost a full body reset. If someone is staring at tea, candy, capsules, and extracts, what is the fairest first question? Does ginger work, or which ginger exposure are we actually talking about?
Exactly. Ginger in food is mainly a flavor exposure. A supplement is a dosing decision. The active pungent compounds, gingerols and related compounds, reach the gut first, where they may affect motility and nausea signaling. But studies usually test measured capsules or extracts, not a random amount grated into soup. So the practical evidence question is, for what symptom, at what dose, for how long, and alongside what treatment?
So, if a viewer asks for the cleanest use case, are we mostly talking about nausea rather than weight loss, cholesterol, or vague inflammation? And are all nausea situations equally supported?
No, and a distinction matters. In chemotherapy-induced nausea and vomiting, a 2024 meta-analysis found ginger capsules worked best as an add-on to standard antiemetic drugs, especially reducing severe acute nausea and high-grade overall vomiting. That does not make ginger a replacement for oncology antiemetics. It means some patients, particularly on highly emetogenic regimens, may discuss ginger as a supportive layer before chemotherapy starts. The effect is also more specific than the ads imply. The meta-analysis reported lower incidence of grade 3 acute nausea and high-grade vomiting when ginger capsules were combined with antiemetics. That is meaningful for a patient whose day is being ruined by severe symptoms. But it is not proof that ginger prevents every wave of queasiness, and trial methods varied.
Pregnancy nausea is where a lot of people search at 2 in the morning. If someone is pregnant and miserable but wary of medications, what can we say without making ginger sound automatically safe just because it is a plant?
The pregnancy pattern is nausea tends to improve more reliably than vomiting. A systematic review of randomized trials found orally administered ginger improved nausea symptoms versus placebo, while vomiting episodes were not significantly reduced, though the trend favored ginger. Lower daily doses under about 1,500 milligrams appeared more favorable in subgroup analyses. That makes ginger a possible nausea tool, not a guarantee against vomiting.
What would make pregnancy nausea a call the clinician situation instead of a try a capsule situation? I am thinking of dehydration, weight loss, not keeping fluids down, or someone already taking multiple medicines. What about the less dramatic cases? Motion queasiness, heavy meal nausea, or a stomach that feels slow? Is the biology plausible, or are people just liking the warmth and bite of ginger?
For a self-limited nausea pattern, the honest trial is boring. Use a consistent product, keep the dose modest, and track the symptom you actually care about. If it is nausea, rate nausea before and after the exposure window. If the problem is vomiting, count episodes. If nothing changes after several comparable episodes, the expectation should change rather than escalating indefinitely. And there is a ceiling to that experiment. Ginger can bother reflux in some people because pungent, concentrated products can irritate the upper gut. Gallbladder disease is another boundary people should not ignore. If ginger worsens right upper abdominal pain, nausea after fatty meals, or biliary symptoms, stop and get medical advice rather than treating it like routine indigestion.
The supplement aisle also sells ginger for metabolism. Do the newer trials make it a blood pressure or weight product? Or is that a much weaker story than the nausea story?
It is weaker clinically, but not irrelevant. A 2026 grade-based meta-analysis found ginger supplementation lowered systolic blood pressure by about 5 millimeters of mercury and diastolic by about 2, with low certainty evidence and more signal at doses of at least 2,000 milligrams per day. If someone is already on blood pressure medicine, that is not a reason to self-adjust drugs. It is a reason to monitor and tell the clinician.
Inflammation is the word that makes everything sound connected. If ginger lowers CRP or other inflammatory markers in meta-analyses, how should a normal person translate that? Less pain? Less disease? Or just a lab signal?
That translation is exactly where safety enters. Concentrated ginger can raise practical bleeding questions, especially for people taking anticoagulants, antiplatelet drugs, or those heading into surgery or dental procedures. The safest rule is not panic over ginger in food. It is disclosure. Tell the prescribing clinician or procedural team about capsules, extracts, and high-dose products before the event. Product quality is the quiet variable. Supplements sold online or in stores may not match the exact products tested in trials. A reasonable buyer looks for clear ginger amount per serving, avoids sprawling multi-ingredient formulas when testing ginger itself, and uses third-party quality signals when available. Otherwise, you cannot tell whether ginger helped, another ingredient acted, or the dose was inconsistent.
So my bottom line would be, ginger is not a body reset, but it has a real lane. For nausea, especially pregnancy nausea with proper boundaries or chemotherapy nausea as an add-on discussion, it is worth taking seriously. For blood pressure, inflammation, weight, or lipids, the evidence is more like a signal to study, not a reason to replace care. Is that the fair compression?